Welcome and welcome back to GrowMed. This is a video in which we will discuss the quick recall of the important one-liners asked in the past years. Okay, so quickly we'll discuss some important one-liners. This will be a short video of some 5 to 10 minutes. So you can watch it in your break time so that you'll not be wasting the time in your breaks also and you'll be recalling the things also. ठीक है, तो कॉफ़ी ब्रेक, टी ब्रेक्स जब भी आपको पढ़ाई से मतलब पढ़ाई नहीं करी जा रही है आपसे, ठीक है, तो उस टाइम पे यू कैन वॉच दीज वीडियोज एंड हैव अ क्विक रिकॉल ऑफ द थिंग्स विच यू हैव रेड. ओके, सो लेट्स स्टार्ट वन बाय वन. विल डिस्कस सम important one liners. Okay, so medicine. Okay, these are the medicine one liners. JVP is a must do topic, so giving it a star mark. You must do, expecting one question from this in the upcoming exam. So joint V wave in JVP is seen in which disease? So it is seen in case of tricuspid regurgitation. Okay, so questions are asked like A wave, absent A wave in which disease, canon A wave in which disease, or they can ask in the normal thing that the A wave visualizes which of the following. Visualizes in the sense what, क्या मतलब ऐसे कि stand signifies, A wave signifies what, so it will signify the atrial contraction. ठीक है, तो ऐसे में this JVP का जो वो है waves and what does it stand for, that one is important. So ठीक है, then causes of the exudative pleural effusion. So this was a question asked and it is the rheumatoid arthritis. ठीक है, तो इसमें exudative pleural effusion दिखता है. Then HIV patient presents with cryptococcal meningitis. What will be the treatment? So for the meningitis, cryptococcal means fungal. ठीक है, cryptococcus fungus है, तो fungal के लिए हम मोस्टली कौन सा यूज़ करते हैं? एम्फोटेरिसिन बी, लाइपोसोमल एम्फोटेरिसिन बी. ठीक है, amphotericin B. This is the treatment option for this one. Then most common cause of Cushing's syndrome in 68-year-old male is pituitary adenoma. ओके, सो सिंपल वन लाइनर आज. ठीक है, तो ये सारे वन लाइनर्स जो है वो FMG एग्जाम से बिलोंग करते हैं, मतलब विच ऑल वर आस्क्ड इन द FMG, दोज ओनली हैव कवर्ड हियर. देन द ग्राउंड ग्लास अपीयरेंस इज सीन इन विच ऑक्यूपेशनल डिसीजेज. ऑक्यूपेशनल डिसीजेज ऑल्सो कॉल्ड एज द निमोकोनियोसिस. ठीक है, तो विच इज सीन सिलिकोसिस. सो इन केस ऑफ सिलिकोसिस इट इज सीन. ठीक है, then secretory diarrhea with hypokalemia and hypovolemia is commonly seen in which pancreatic tumor. So they are asking the question of the pancreatic tumor which will lead to this hypokalemia and hypovolemia, and that one is the VIPoma. VIPoma. ठीक है, then amyloid deposition in dialysis dementia, it is the A beta 2. So amyloid, this one is also a repeat topic and there are asked the questions regarding the various types, like in dialysis dementia, then in Alzheimer's which kind of amyloid is deposited, all those things. Then so two hormonal abnormalities, increased aldosterone and decreased renin, is seen in which disease? So it is seen in the Conn's syndrome tumor, a disease occurring due to the insufficiency of the adrenal gland. ठीक है, तो adrenal insufficiency की वजह से होता है ये. So yes, ठीक है, Conn syndrome. Then CVP is increased in which type of shock? Central venous pressure, it is increased in cardiogenic shock. ठीक है, cardiogenic shock में CVP is increased. J wave on ECG is suggestive of hypothermia. ठीक है, तो ECG is an important one and you will get one question from the ECG, so note it down and read all the points related to the ECG. ठीक है, तो किस डिसीज में कौन सी ECG दिखता है, the special features or special findings like this J wave, this is seen in the hypothermia like the Osborne wave, then absent P wave, all those things. Then most common cause of pulmonary embolism, so it is the DVT, deep vein thrombosis will be causing. So case based questions have also been asked on this pulmonary thromboembolism, and investigation of choice has also been asked. CT angiography, image based question is also asked. ठीक है, then gold standard test for the diagnosis of the TB, it is the culture of the CSF, culture. Then most common cause of primary headache, it is the tension headache. Okay, so the types of the headache, like the tension headache, then the migraine, you need to know the features also and the presentation also. Then Best treatment for acute MI is the PCI. Okay, so percutaneous coronary intervention, this one is the like best preferred, and it depends on the time also, right? So if not, if the time is excluded, like if the patient comes to the hospital more than the limited time, then we will be giving the thrombolysis. So if the question is as simple like this, then PCI. But if they mention any time and they ask like what are the other option modalities, then thrombolysis. Okay, then most common cardiac lesion in a child with rheumatic fever, it is the mitral stenosis. Okay, then a young man can't speak fluently but can inform things in the writing. What is the lesion seen and which area is affected? So it is the Broca's area which is affected, and this is also the aphasia. Broca's aphasia. Okay. This is also important because questions are asked like Broca's aphasia and Wernicke's aphasia. Repeat topic. Okay, then first sign of hyperkalemia is tall T waves. Tall T waves changes seen on the ECG. Okay, so we are speaking about the ECG here. Then investigation of choice for the Wilson's disease is the liver copper levels, liver copper levels, or if this is not given, then a biopsy of the liver to look at the copper levels in the liver parenchymal cells. Okay, then hepatic biopsy can also be given like this. Okay, then type of anion gap seen in the RTA means renal tubular acidosis, so it is normal. Then most common tumor of the pituitary gland is the non-functional adenoma. So these were some important one-liners asked in the past years, and I think yes, it will help you for the quick recall, and expecting that like one or two questions can come from this. Okay, so thank you so much for watching this video, and for other subjects also already I have uploaded a subject-wise one-liner like for anatomy, physiology, pathology. So have a look at those also. And thank you so much once again. If you're new to GrowMed, subscribe to GrowMed, like the video, share it with your friends, and comment below how do you find this video. Okay, thank you so much guys. Once again, I am Dr. Padmini, your mentor for the Fmge, and join my Telegram channel for more useful stuff. Thank you so much.